Good morning, good afternoon, good evening, everyone. Welcome to this roundtable, Breaching the Disability Gap, Changes Needed to Make an Inclusive COVID-19 Response and Recovery. It's indeed a pleasure on behalf of the organizers and all the speakers whom I would like to welcome and thanks for making your time available for this event. Is indeed something that we really want to do in line in promoting the right of persons with disabilities and the social protection systems. We do have a very packed agenda, so I would like to quickly get started. Before I do that, please be advised that this roundtable has sign language interpretation as well as closed captioning, and actually we will try to make this meeting, this gathering, as inclusive and accessible as possible. So we have prepared some reasonable accommodations in order to ensure that we all participate on an equal basis. That is why we have Alex Cote, who will be assisting me, and he will now start showing the PowerPoint presentation that we have prepared for the roundtable. It is important to say that for any individual, social protection systems are one of the most important elements in the life of any person. However, this situation is even more necessarily when we talk about people with disabilities. Sometimes we forget to say, but systems related to social protection allows or somehow ensures that people with disabilities have basic income security, can access to basic healthcare services, can cover the cost of disability supported services, can access to rehabilitation systems, etc., etc. And just to give you very general information about where we are at in terms of including people with disabilities in different social protection systems. And if we look at the SDG indicator 1.3.1, we can clearly say that only 18.5% of people with severe disabilities in low mid-income countries are receiving disability cash benefits. And that percentage, which already very little, even drops down to 1% if we look at the low income countries. Well, if by saying this, we sort of agree that the real picture is not promising, but rather very concerning, when we look at what has happened with regard to COVID-19 response plans, we can see that only 1/3 of the countries that have put it response plans regarding COVID-19 have put some measures, some specific measures towards people with disabilities, and most of them have been focused on ad hoc cash benefits for people with disabilities. This is just some general information which shows how difficult people with disabilities is for people with disabilities in trying to accessing these type of services. And that's why I think that the fact that in this webinar, we have government representative, international organizations, official, etc., is an excellent space for not only realizing the need of working harder and moving along, but also to listen to what other peoples are doing with regards to including people with disabilities. And that is exactly what I would like to invite all the speakers in this webinar to start sharing with us. Let me then introduce Dr. Luca Pellegrano. He's a senior social protection specialist from ILO Regional Arab States. Welcome, Dr. Pellegrano. Thanks for your time. And I do have one question to start with, and you have 5 minutes to answer 2 questions. So let's get into the first question. You know that there is a big economic crisis in Lebanon, and ILO together with UNICEF have made enormous effort in ensuring that people with disabilities get the support they need around social protection system. Actually, you have very strategically argued the fact that we need more categorical targeting for persons with disabilities and elderly people in order to ensure accessing to social protection system. Can you tell us a little bit what is the rationale behind your thoughts around this, and what are the challenges for this approach? The floor is yours, Dr. Pellegrino. Thank you for your time.
Thank you very much, Jose, and thanks for the invitation. Indeed, as you mentioned, the COVID pandemic and more recently the explosion in the port of Beirut add to a very complex context in Lebanon as the country grapples with a very severe financial, economic, and also political crisis. Social protection systems are weak in Lebanon, as the provision of social welfare and basic services has historically been the prerogative of religious groups or so-called sectarian groups rather than the state. So building a national social protection system has been at the core of the demand for a new social contract since the popular uprising in September. And in setting the foundations of a national cash assistance system, organizations working for the rights of older persons and also the rights of persons with disabilities have made the case for adopting a more inclusive categorical targeting based on life cycle risks and vulnerabilities, as opposed to safety nets targeting the extreme poor. They have in particular proposed the inclusion of a universal social pension and a universal disability allowance. And this position is built on both policy and technical considerations. At the technical level, in the current crisis context, poverty in Lebanon is widespread and very fast rising. And also dynamically changing. So in the absence of recent data from national surveys, poverty targeting tools built on proxy means testing risk leaving behind large numbers of vulnerable families and individuals due to inbuilt exclusion errors. Moreover, the limited transparency and understandability of the selection process risk undermining trust in the system and fuel the perception that support continue to be delivered on the basis of religious or political allegiance rather than on the basis of rights and citizenship. Now, at the policy level in Lebanon, like elsewhere in Lebanon, like elsewhere in the region, persons with disabilities face barriers related to inaccessible services, infrastructure, and transport. And these barriers restrict the participation of persons with disabilities in social and economic life and generate extra costs, as you were mentioning. Not only persons with disabilities spend more, but they also tend to earn less. And it is therefore important to emphasize that this matters, these barriers exist across all ages and across all economic, regardless of economic status. So in the proposal of the organizations of persons with disabilities, universal disability inclusion allowance would compensate for the basic disability-related costs that every person with disability living with a disability faces, and therefore would not be poverty targeted and should be compatible with work and with other social protection benefits, so to effectively contribute to combating poverty and promoting social economic participation. The jury is really out as to how this lively debate will translate into programming and financing decisions. But it is clearly now much stronger understanding amongst government and international partners that Lebanon will need both an anti-poverty cash transfer as well as life cycle risk-based social grants to deal with the overlapping crises that the country is facing.
Thank you very much, Luca. It's indeed a hard work, but it's very much needed. Could you tell us a little bit in the context of the work that you are undertaking, what is the role of OPDs, Organization of Persons with Disabilities, and how you ensure meaningful engagement of these organizations in this work?
Yes, so the involvement of the disability movement has been very strong in the development of a national social protection strategy, and it has been at the core of our work also as UN in the past few months. And the engagement has been twofold. On the one hand, to mainstream disability in national social protection dialogue by ensuring participation of organizations of persons with disabilities in the national policy making and program design conversation. But on the other hand, and in preparation for the above, we have also tried to establish a more dedicated platform for internal discussion amongst organizations representing persons with disabilities, of persons with disabilities, so to identify common points of concern, advocacy, and to develop a common understanding of the relevance of social protection for the disability inclusion agenda. A collective of organizations has regularly and virtually met in the past few months and produced few joint products, which I will make available, including a brief on the COVID-19 response with some specific recommendations, as well as a position paper on inclusion of persons with disability in the rights social protection system. And I would like to highlight in particular 3 aspects that have been interesting from our perspective as a facilitator of this process. The first, that there has been a great value in the disability movement speaking with one voice, with one single voice. The process in Lebanon has been important to overcome fragmentation across organizations, to enhance representation and visibility of the movement as a whole. And this, however, requires a dedicated investment. It takes time, it takes regular interaction, and a neutral and a trusted convener. The second point is that all pillars of a social protection system are relevant and merit being looked from a disability inclusion lens. For instance, recommendations on the COVID-19 response have ranged from advocating for access to healthcare, to avoiding disruption of essential support services, to enhancing opportunities for labor inclusion, to access to social assistance and disability sensitivity in the design of social insurance schemes. So really all these components are essential and mutually reinforcing, and taking a system-wide approach adds value in the engagement of the disability movement. And the third and my last point is that there is really need to overcome a certain vision, which is also rooted amongst organizations of persons with disabilities, that calling for income support for persons with disabilities is necessarily associated with a paradigm of dependency and disempowerment, and that instead advocacy should be focused on labor market inclusion. Recognizing the role of rights-based social assistance as an enabler of fuller participation of persons with disabilities in social and economic life have been and can be a game changer. And surely it has been for the collective that engaged throughout this process in Lebanon. Back to you, Jose, and I hope this was helpful.
Thank you very much. Thank you very much, Lucas. Very much appreciated. For those participants who have direct questions for our first speaker, you can just type it in the chat box and all speakers will be able to answer. Otherwise, we will also have a very quick Q&A session, if time permits, to answer some of the questions. Let me now introduce our second speaker, Mrs. Fabi Nyaguri from Kenya. She is the Deputy Director for Social Development at the Ministry of Labor and Social Protection. Thank you, Phoebe, for being with us today. The first question for you is, in Kenya, there has been already a system in place for poor household with a person with disabilities, giving them cash benefits. But as the COVID-19 crisis hit the country, you rapidly put it in place some extra measures to support with cash benefits to people with disabilities. Could you tell us a little bit what was the reason for doing so and what are the results so far? Please remind that we really have to keep our time of 5 minutes for the 2 questions. Thank you, Phoebe, and the floor is yours.
Can you hear me? Can you hear me?
Yes, go ahead, Phoebe. Yes, go ahead.
Okay. Yeah, in Kenya, social protection is a constitutional right. The Bill of Rights in the Constitution of Kenya guarantees all Kenyans their social, economic, and cultural rights, and binds the state to provide appropriate social security to persons unable to support themselves and their dependents. The overall objective of social protection in Kenya is to ensure that all Kenyans live in dignity and exploit their human capabilities for their own social and economic development. So in Kenya, we have been providing, as you have said, so cash transfer to various people. That is the first one we have been providing to the orphan and vulnerable children. We also provide cash transfer to older persons and to persons with severe disabilities. So during COVID, there was greater need for us to ensure that people are all taken care of, but particularly persons with disabilities. Already, the country is taking care of persons with disabilities in the regular cash transfer program, where we have a total of 47,000 households that are receiving cash transfer for persons with severe disabilities. But we found that this number is very small in Kenya, very small compared to the other cash transfers that are also being given. And we found this to be an opportunity for us to increase this number. And that is why the first thing is that number was small, we wanted to increase the number. That was the first reason. The second reason was that persons with disabilities were more affected economically than other vulnerable groups due to their already existing vulnerabilities and the fact that most of them have underlying medical conditions. Yeah, for sure, many people with disabilities had underlying medical conditions like hypertension. Some of them have diabetes, and some of them had cancer. So because of this, there was need for us to do something extra to bring people on board. At the same time, um, so because of this, the government set aside about 500 million Kenya shillings to cushion persons with disabilities against the adverse effect of COVID-19. Some of these funds were used in paying the arrears for those who are normally in the regular cash transfer program, but for one reason or the other, they have not been receiving their funds. So they were also taken care of during this time. And every constituency during that time was given an additional 124 slots to add to take care of the new cases that were affected very much during the COVID pandemic. And this was to be taken care of in just 3 months. And they were supposed to get 2,000 Kenyan shillings per month for 3 consecutive months. In addition, in addition to what I've said above, persons with disabilities also benefited from some other funds that were put aside for cash transfer for other vulnerable groups to be cushioned against the pandemic. These were normally not persons with disabilities, but they also benefited from that fund. So far what I can say, this thing was very much necessitated because of the few numbers that we had, because of the very severe cases that we had in disability, and because these people are they were economically affected. So the government had to keep sure that they were able to be given extra.
Thank you, Phoebe. Thank you very much for sharing that great experience. I'm sure you would agree with me that one of the main challenges around social protections and how to reach out to people with disabilities is actually the identification process, how to identify people with disabilities and therefore the different beneficiaries that these type of services can reach out to. Could you tell us a little bit how was the approach used to quickly cover those needs, and as particularly with regard to identifying people with disabilities? In 1.5 minutes, please. Phoebe, I'm sorry for being so strict with the timing. Thank you.
Thank you very much. The approach that we used during that time was that the government put in place a multi-sectoral team that consisted of officers from the State Department for Social Protection, both at the county and sub-county level, national government administrative officers, Ministry of Health officials, local disabled persons organizations, and community leaders. They were given a targeting tool that they were to use in their various counties. Every county had this team of officers, and they were to now identify the various people that were affected that were not in the regular cash transfer program. And at the end of all of it, the National Council for Persons with Disabilities, which is a government agency that takes care of disability in Kenya, together with the Department of Social Development, they work together to put all these cases that were identified together and registered them as cash transfer beneficiaries. And then at the end, 33,000 beneficiaries received 6,000 shillings each for the 3 months. And at the moment, the State Department is in the process of enhancing or expanding the single registry, which is to inform future identification of beneficiaries to social protection responses. So basically, that is the approach that we use. It was the multi-sectoral, team that was put in place, and they worked very fast. They were given time. They were targeted, and they were given very few time to do that. And because we find that in the counties, there are always people in the waiting list. So they started with looking at this waiting list. Who are the people in the waiting list that they could take that have not been, absorbed in the cash transfer program? So that one also really hastened our process of identification. Thank you.
Thank you very much, Phoebe. Thank you very much for your contribution. Let me now welcome Jeffrey Ortiz from Dominican Republic. He's the General Director for the unique system of beneficiaries. Jeffrey, the first question for you is, we know that in your country, together with UNICEF, you have incorporated measures around cash benefit to children with disabilities. And the fact that you have this unique system of beneficiaries had played a significant, relevant role. Can you tell us what was your experience, your approach with regard to this experience in your country? Welcome, in 2 minutes, please.
Muchas gracias por la invitación. A raíz de la crisis del COVID, el gobierno dominicano lanzó una serie de iniciativas dirigida a proteger a la población más vulnerable. El programa fundamental que se implementó fue el llamado Quédate en Casa, donde se aumentaron las transferencias monetarias a los hogares que ya tenían dicho beneficio, pero también se asignaron mayores recursos a grupos vulnerables específicos como personas envejecientes, personas viviendo con VIH, personas con discapacidad, y también se adicionaron unos 700,000 nuevos hogares pobres o vulnerables ante la crisis. Es ahí que en este contexto UNICEF, recibimos el apoyo de UNICEF, tanto financiero como técnico, para lanzar un proyecto piloto de una transferencia monetaria de $38 mensuales a 2.700 hogares con niños y niñas con discapacidad severa. Con el mismo se buscaba ampliar la protección social del programa Quédate en Casa y fortalecer la adaptabilidad de nuestro sistema de protección social ante emergencias y choques como el COVID-19. Ahora, ¿cómo lo logramos de una manera tan rápida? El país cuenta con un sistema, un sólido registro de beneficiarios para los programas de transferencias monetarias. Este registro cuenta con el 65% de la población que está identificada y clasificada a nivel nacional con el índice de calidad de vida. Aquí el Sistema Único de Beneficiario clasifica esta población según también el índice de pobreza multidimensional. Esto fue lo que nos permitió identificar a aquellos niños y niñas con discapacidad severa en hogares vulnerables. Y esto fue lo que permitió de una manera rápida montar este programa y llegar exitosamente a esta población.
Jeffrey, thank you very much for your first answer. And it's clear how important it is to have strong social protection systems with good registries available. With that said, what are the plans for the future? What do you think is the most important elements for the future in this combination of good social protection systems and good registries available in the countries? Can you tell us about that in 1.5 or 2 minutes, please?
Sí, gracias. No hay duda de que la emergencia sanitaria provocada por el COVID-19 va a durar un tiempo relativamente largo. Eso significa que en un contexto de restricción presupuestaria, el gobierno y los gobiernos no van a poder mantener la magnitud de las transferencias monetarias a todos los hogares. Por lo tanto, se hace necesario adaptar los sistemas de protección social y adaptar las transferencias a los grupos todavía más impactados negativamente por la pandemia. Impacto que va a durar, que puede durar un tiempo largo. Para poner un ejemplo, solamente el 35% de las personas con discapacidad, según una encuesta que se hizo recientemente, no tuvieron acceso a medicamentos y otros insumos médicos durante la pandemia. Hemos estado monitoreando y este porcentaje se ha mantenido por encima del 30%. Esto justifica este nivel de protección a estos grupos vulnerables. Por lo tanto, el éxito y rapidez en el diseño e implementación de este programa que se hizo conjuntamente con UNICEF nos arroja grandes aprendizajes para seguir fortaleciendo el sistema de protección social del país, con mayor capacidad de adaptación y reacción ante choques como el de la pandemia COVID-19. Ese es el gran aprendizaje de que sí se puede.
Thank you, Jeffrey. Thank you very much. Yes, indeed, we can do it. It's just a matter of how to do it. Let's now invite Mrs. Hala Derwish from UNICEF Syria. She is the social policy officer for the UNICEF country office. Also to learn about some of other experiences from UNICEF about this type of activities. The question for you, Hala, and thanks for your time, is you, with the support of UNICEF, have put in place in Syria during the conflict a great source of cash transfer to children with disabilities. And that process was also connected to access to different services for children with disabilities. Can you tell us more about that experience, and what do you think are the positive outcomes of that connection between social protection systems and access to services? Welcome, and the floor is yours.
Thank you very much. Thank you all for attending this useful session for all of us. Indeed, just to start where you finished about the humanitarian context of Syria, where we have, the crisis started like 10 years back, and it's still continuing. And we have many people who are now in vulnerable and considered to be poor. And amongst the poorest people in Syria, we have identified the children with disabilities being UNICEF mandate. Just to come back to the humanitarian cash transfer for children with disabilities, which was built on the pre-crisis national cash transfer program for people with disabilities, which was implemented by the government, by the Ministry of Social Affairs. So UNICEF and in 2016 introduced a model of integrated social protection scheme combining regular cash transfer to families of children with the severe disabilities and in addition combined with the case management services. Of course, this is what we can consider it as, we can call it as cash plus. For more details about the humanitarian cash transfer, you can you can refer to the link of the webinar presented on 17th of September with more details about Syria experience in implementing cash transfer. While today I'm going to focus about the services provided through case management component of this program, because the program aims to address both social and economic vulnerabilities, which represents the demand and both demand and supply side. While the cash transfer addresses the financial barriers, the case managers, the trained case managers assigned to every child through the implementation of this program have a key role in ensuring that the families of the children of disabilities and their families are included in are receiving the available services through the referral mechanisms. Of course, we during the life cycle of the program, we have conducted monitoring surveys to measure the impact of the providing cash transfer to the families and their children, and from the results, we noticed that we have high satisfaction of the families and their children about the work of case managers. We have noticed that we have increased in the investment of in healthcare and education of the children with disabilities. We have also noticed the shift from primary to specialized health and education services. Of course, it was noted also that we have a high decrease in the dropout rate amongst children with disabilities, which is really important, which refers to the role of case management services provided to ensure inclusion of our children in the public school in case available, and in case we have private schools for those children. It's also not worth mentioning, of course, the PDM results. In case you want to have more information about it, you can refer to the link of our online monitoring surveys, which can be shared now. Just to come back, of course, it's worth mentioning that the case management services had another key role in updating the database for the government for the people with disabilities and children with disabilities, because it is part of our verification for the eligibility of the children to be enrolled in our program is to obtain a disability card, which is done through the support of government. It's provided by the government. So whenever any child doesn't have any disability card, they will refer to the nearest Directorate of Social Affairs in their location to obtain this disability card to be enrolled in our program, which helped a lot in the building the database of course, this was interrupted due to the crisis. So it was really helpful to be able to build this database.
Thank you, Hala. Sorry.
Yeah.
May I ask you the second question, and perhaps you can connect the two little answers here. In which way you think that what you are describing can become at least a good model to follow in an effective cash management? That is the second question I had, and perhaps you can combine the two answers in the next 2 minutes. Thank you.
Thank you very much. Of course, you know, building on as this was introduced as a humanitarian cash transfer during the crisis, but it was really helpful and entry point for our discussion with the government at the policy upstream work to introduce the development of integrated social protection management information system to be able to address the fragmentation of the social of the government-run social protection schemes. Another important point was the social workforce initiative, which is building the capacity of the social workers of the government through providing technical and academic support. Also, it helped us to promote the integration of social protection schemes to have the social services available for the benefit of the service user and to improve the efficiency of the service provider.
Thank you very much, Hale, and sorry for the interruption. I know that we are in like a marathon here, trying to cover as much as we can, but the intention of this webinar was actually to give you just general information and just to start off the discussion with all these great inputs from all the speakers. And thanks for the comprehension. Thank you for the understanding from each of the speakers. Let me now move on to the last speaker. Her name is Charlotte Buku from Fiji. We have a video message from hers because it's a bit earlier in Fiji. It's 4 a.m. now, but I'm sure she will give us a lot of relevant inputs. She is the Principal Welfare Officer for the Disability Unit at the Ministry of Women, Children, and Poverty Alleviation of Fiji. And we will hear from her about what activities, what measures are being put in place in Fiji in this time of crisis. So Alex, I think we can now play the video, and after that, please, all participants get ready to ask questions if you haven't done so. We will try to cover as much as we can in the very limited time available. Alex, can you play the video, please?
Fiji has decided to make its individual disability allowance scheme compatible with paid work, as well as household family assistance benefit. Can you tell us more about the rationale of such a design?
Thank you. Hello, everyone. The reason why Fiji has actually introduced an allowance that is
Alex,
not.
Can you let me know that if we are playing the video or we are about to play the
video is playing. You are not hearing.
Oh, sorry, I couldn't hear anything. Sorry about that. Thank you.
Is because we recognize that persons with disabilities also need support services. They also need assistive devices, which is quite expensive. So when we actually spoke with our leaders, we felt that because the extra cost for persons with disabilities is such that we actually open it up, given that it's a right for all persons with disabilities.
Thank you. Thank you very much. Persons with disabilities often complain about the challenge they face in obtaining disability certificate required to access social protection benefits. How did you overcome this obstacle to facilitate registration and enrollment of beneficiaries, especially considering the multiple islands and remote areas of Fiji?
Fiji has about 300 plus islands. What we recognized from the offset of the allowance was that when we did a scoping of our office space, we found out that it was not accessible. To ensure that we reached the majority, what we decided was a community sweep would be the way to go. So we employed 17 welfare officers with 15 clerical officers who went out into the communities. We ensured that there was a budget to actually go from community to community, door to door, to ensure that we actually don't miss anyone out. That was adopted. We were given funding for that for 2 solid years, whereby we actually assured our leaders that within 2 years, we have 100% coverage of Fiji which we did by the second half of the second year.
Yes, can you give us a little bit of detail of how the assessment was taking place and the type of service that were also provided during the identification?
What usually happens is that when we go, there are two ways that we get referrals. The first one is by phone, whereby the referee would call and tell us, oh, we have a person with disabilities living in this area. Can you please help us? They really need assistance. So we would actually send a welfare officer to have a look at and actually fill in a form. If the person did not meet that qualification, we would make sure that we took extra forms for the other social protection programs. For areas that we went to and it was quite far off, we made sure that we actually consulted not only with the disability provider organizations, we also made sure that the community leaders were informed that a team was coming down. What we did for this exercise was we made sure that we took our phones with us. If we had a laptop, so that we actually taking services to the communities. When we actually left the community, we actually completed, if they met the assistants, we made sure they had their ID cards with them. We also made sure that if we had to come back to base to actually get the approvals done, get the necessary processes done, that within a period of 3 weeks maximum, that we would actually go back and make sure the money is given to them. So that was what we did. Something we also recognize is that majority of our offices in Fiji is not accessible because of flooding in some of the areas where our office space is. What we did was we actually informed relatives, family, community leaders, even health workers, even disability provider organizations, that if they had a team that they wanted to set up in a home, that we would just bring our services to them.
Thank you very much. Just a last point. It seems that you have a very close collaboration with DPOs in all this work with regards to the disability allowance. Do you think that it has contributed in the way you designed and rolled out the disability allowance?
For Fiji, we've always recognized that the primary person, or the person that will know more about the barriers they face, is a person with disabilities. From the very outset, we actually went to them when we were in the phases of putting the form together. The good thing about this is when they didn't agree with us, they said it straight to our faces. We don't agree. We think that you should increase the ranking from 3 to 7. We think that you should add more questions to actually beef up the form. They were also very instrumental in our taking it out, because there were things I didn't actually think of in the initial stages of planning. The office space, would they be able to come to the office space? The extra cost, would government be able to actually take the service to them? The other problem that we faced that I wasn't really upfront about when we first started, and I thought it was okay, was the reason why we had to get rid of the medical report. For medical reports, Fiji charges about $53, $54. From the offset, the DPOs told me that $54, $57 to them goes a long way. So we took it back to our advisory arm that deals with this, and he said, if the state's obligation is to meet the cost, if we can't, then we might have to look for another tool to use to measure, to use as a measurement tool for our loans. So we were lucky that when we came and saw Josh and Dr. Siti was then the executive director where I'm sitting now, they introduced me to the functional independence measure tool that we're using. From the offset, I had to make sure that I was able to ask the DPOs the questions, because the questions are quite personal questions. It was interesting because when in piloting this program, it actually strengthened the relationship that was with the unit and the disability provider organizations. So as we rolled it out, the DPOs actually told us, okay, we have members in this area, this area, this area. Can you please send the staff there? The relationship that has, and the bond that has developed, I can say now that we've gone so comfortable with each other that they continue to be the voice of reason that I turn to when a program is being set up. So every program that we do for persons with disabilities, we actually ask for their input to it. We don't implement it if they have reservations on it until we get the at least the majority support from the sector. Then we implement a program like our allowance.
Okay, thank you very much. We have now completed the first round of interventions. Again, thank you to all the speakers for managing the time perfectly, and my apologies for just rushing some time, but we really wanted to get the different views from different experts. I can already see some good interaction in the chat box, people extending congratulations to the work that Jeffrey's doing in the Dominican Republic, for instance. I do have some questions for some specific speakers, but also some general questions which I would like to address. Let me start by asking one question to Lucas. Lucas, one of the questions that we received is around how did all different UN agencies involved in this social protection experience that you described manage to speak with one voice around this issue? What can you tell us about that exercise?
Yeah, thanks for the question, and thanks to Zehra who put it on the Q&A tab. I think indeed in Lebanon, due to the absence of a comprehensive and coherent national strategy for social protection, it is somehow easier at times for agencies to work in silos, to focus on different bits and pieces of the system without necessarily following let's say a more coordinated approach and plan. Yet I have to say in Lebanon we have been quite lucky. At least within the UN system, we are operating under a UN joint program which brings together UNICEF, the ILO, WFP, UN Women, UNDP, to really sort of have a common front when it comes to matters of social protection and recognizing the respective points of added value that each of these agencies bring. And so all the work I refer to when it comes to consultations and engagement of the disability movement on the development of national social protection strategy, as well as of specific, let's say, disability inclusion related measures, has actually been joint work by the ILO and UNICEF, with whom I think with UNICEF in particular, we have a strong platform of alignment when it comes to a progressive vision for rights-based social protection framework. It is true that with other UN agencies, somehow collaboration may be harder, or alignment, particularly along the lines of the more humanitarian or poverty-focused versus the more, if you want, rights-based building of national systems. And that's where the social protection floors can really help us all, converge on a common framework, on a common conceptual framework. And I have to say, in Lebanon, this has been quite fruitful and quite positive as a basis for joint work.
Thank you, Lucas. Let me propose something and see if we can do it. One common question is for all speakers, actually. One thing, what do you think? Just one thing that you believe made all the work that you have been doing disability inclusive and focus on persons with disabilities. Just one thing that you really want participants to take away from this meeting. Phoebe, do you want to start? Maybe Phoebe's having some challenges with her mic. Jeffrey, do you want to share one thing that you think made this possible in terms of disability inclusion and focused on people with disabilities?
Thanks, José. Nosotros pensamos que es necesario, cuando estamos enfocándonos a personas con discapacidad, tener un registro nacional de personas con discapacidad. Y el hecho de que desde el Sistema Único de Beneficiarios en República Dominicana pudimos incluir las preguntas del grupo de Washington relativas a categorizar los niveles de discapacidad en nuestro registro, le da una, digamos, convierte la herramienta en un poderoso instrumento para llegar a los más necesitados, más vulnerables en el contexto de una crisis sanitaria como la que estamos viviendo, con implicaciones económicas y sociales. Por lo tanto, un aspecto importante en todo esto es visibilizar, registrar e identificar a esta población.
Thank you, Jeffrey. Definitely, that's a collection. Has to come along with all these other things that we have been discussing today. Hala, do you wanna share your thing that you believe it made disability inclusion a reality and focus on people with disabilities?
Yes, sure. Thank you for the question. And from our experience, especially for our context, the humanitarian context, it is really important to look at the available national schemes and build on it. For Syria, the social protection scheme was there, but interrupted due to the crisis. So we used it as entry point to build on our humanitarian cash transfer. And in addition to that, introduction of the case management component was also an asset to the inclusion of our children with disabilities into the program and into the available services in the country, because they had this role I mentioned earlier. So having this component like the Cash Plus program is really key in providing including the children with disabilities in all the services. Over to you.
Thank you so much. Thanks for that great experience and for clearly referring to what I think is needed, particularly with children with disabilities. Thank you, Hala. Phoebe, are you available to make your contribution? Go ahead. Thank you.
I hope you can hear me now.
We can hear you perfectly, Phoebe.
Yes, thank you very much for that question. What I could say in Kenya that has made it very possible for disability inclusion to be accepted is the role that the government has played. You know, the support that we get from the government, and this has been because when you look at our laws, to look at the constitution itself, when you look at the UN Convention which Kenya ratified, and even during the Global Disability Summit, you know, Kenya participated so much. So the laws that they put there and the support for persons with disabilities has really made it easy for issues of disability to be, you know, included in the various laws, the various policies that makes it possible that when you are doing something, you always think of what do we do for persons with disabilities? How do we bring them on board? So for me, it's the support that we have received from our government.
Thank you very much, Phoebe. Thank you very much. Lucas, sorry, but if you can just type your answer on the chat box in order to quickly move to the closing segment of this webinar. My apologies for that, Lucas, but I'm sure participants are interested to also reading what you have to say about this one thing that may your experience disability inclusive and focus on people with disabilities. Let me now invite the representatives from UNICEF first, Atif Khrushchev, and I hope I'm pronouncing your last name correctly, Atif. And then Veronica Waksak from ILO, just to give us some closing remarks. Atif, the floor is yours. 1 minute, please.
Oh, thank you. That's a challenge. I have a long list of things that I wanted to say. And you pronounced my name correctly. Going straight to things, I have quickly run through a few points which colleagues have already raised. Number one, COVID has hit hardest the people with disabilities, as we know that they have faced poverty differently. And one key point here is, because the existing social protection programs weren't disability sensitive, as we saw the data in LDCs and LMICs, during the COVID, the expansion and scale up of existing programs aren't disability sensitive. So we need to work on systems for disability sensitive social protection and disability inclusive social protection. Children face specific problems, as we all know. It's not just about poverty, it's about accessing health, education, transportation, services, and all that, nutrition. So they face specific, disproportionate and differentiated impact of the COVID and of disability. So we need to be really mindful of children when we talk about disability. In terms of response, we need to prioritize progressive coverage of universal disability allowance, which should be sensitive to the cost of disability, including additional cost of transportation, additional cost of the hearing aids and all the other stuff that goes with the in the daily lives of people with this disability. We also have to be mindful of a life disability with life course approach. Disability is not a stagnant thing. Different groups of people, from children to old age, face different types of disabilities and they face different risks. So we need to be mindful of that risk along the life course, from a child, infant, till he gets old age, and map what those risks are and how a social protection system should respond to that. And I think that's a very important point. And probably the last point is that let's not just look at disability and poverty, let's look at disability and the range of social protection services or social care services, including, of course, in early age for education, health, nutrition, mental well-being, and all the essential services, and make them as part of a larger set and network of social protection systems, so that we have a sufficient coverage. Just giving one disability grant and one disability money is not going to address the issues facing persons with disability, no matter how much cost we include in that. It has to be a network of services complemented by cash and complemented by other services. So we have to look at the entire system itself first, that what support mechanisms that person living with disabilities have. And of course, lastly, as UNICEF, we are absolutely thrilled to be part of the UNPRPT project that we are collaborating with ILO and IDA and other partners. We will continue to promote these ideas and this vision that we share with all the partners who are around the table. And we are happy to support and really, really excited to be part of this conversation. Over.
Thank you, Atif, and thank you for your great contribution. Veronica, do you want to share your closing remarks?
Sure, I'll be super quick. I know we are already over time, but let me just build on what Atif and all the other speakers before emphasized. We all agree it is important to move towards a universal disability allowance so that all persons with disability get compensated for extra cost of disability and receive benefits in line with their needs. From an ILO perspective, it is really important, but also from a disability inclusion perspective, it is really important that this allowance is designed in a way that it's compatible with work. And this is absolutely crucial. We've heard persons with disability have bigger problems in finding a job. They are the first to be let go. If we don't ensure that benefits are compatible with work, there's a very high risk that this will have exclusionary effects for their participation in the labor market. And likewise, active labor market programs, they have to be disability inclusive, and we have to ensure that they also encourage participation of persons with disability that are able to and willing to work to access decent jobs. And we've also heard the importance of making disability allowances compatible with other income support. An elderly person should be entitled to an old age pension as well as a disability allowance. Atif already talked about the importance of linking also services into, so cash plus. Cash is important, but not enough. We need services as well. So I won't go into that, but one thing that is really important is disability assessments and determination, and to ensure that they are simple enough that they can be carried out at the community level. Fiji was a really impressive example of how they really reached out to people and visited people, so that this really increased accessibility for persons with disability to actually get their disability entitlements. And the very final word, we've talked a lot about about the expenditure side. What do we need to do to design disability benefits, and what is the level of benefits we need to provide. It is also important to look at the revenue side. This is not disability specific, but it is important. These social protection systems, they need to be collectively financed, and they need to be financed through progressive means. If we have regressive tax systems, etc., it will undermine the impact that we can achieve through our social protection systems. And with this, I'm going to close because we're already over time.
Thank you, Veronica. Thank you, everyone. For those who did not have the chance to read the bios of the different speakers, I would just say that I'm representing the International Disability Alliance. They are a global organization that represents over 1 billion people with disabilities around the world. I will just close this session by thanking the organizers, thanking the speakers for the great contribution, thanking the participants for your active engagement. There will be more chances to participate. But before you all go, I would really like to invite you to reflect on one thing that for me is very important. We have discussed here different experiences, different good practices, problems and challenges that are faced by people with disabilities around social protection. And indeed, there are around the world great social protection specialists, people that have been working around this for many years, and we really want to learn from the OPDs about what you are doing. But at the same time, we really want to make sure that you share the view that the people who knows what we need is exactly people with disabilities. We are specialists on what matters to us. So the more you engage with people with disabilities and their representative organizations, the higher chances of having your programs, your policies, not only CRPD compliance, but also effective, inclusive, and accessible for all. I really want you to reflect on that. The more you engage people with disabilities in your design, implementation, and monitoring process, the more successful programs we will have in place in the near future. Thank you, everyone. Hope you have enjoyed the session, and I hope this session served as an opening door for further discussion. Have a good rest of the day. Thank you.